To preserve and protect the airway is to preserve and protect life itself. A tracheostomy is one method of preserving the airway in patients who have difficulty with normal laryngeal airflow. A tracheostomy can totally bypass the larynx to ensure adequate airflow if there is laryngeal pathology or other problems. People who may require a tracheostomy include people with laryngeal cancer, vocal cord paralysis, neurological problems, and people who may intermittently require the assistance of a mechanical ventilator for breathing. While a tracheostomy can be life-saving, one major problem with the trach is that since the vocal folds are bypassed, speech may not be possible. A Passy-Muir valve is a one-way valve that is attached to a tracheostomy tube that allows for the entry of air but does not allow for the exit of air. A Passy-Muir valve is often used in patients who may be recovering from their laryngeal problem and are beginning to use their vocal cords. A tracheostomy tube cuff is an inflatable circumferential balloon that allows an adequate air seal so that a ventilator can be used to push air into the lungs. The inflated cuff also prevents aspiration of secretions or liquid from the oral cavity into the lungs. It is of critical importance that if a Passy-Muir valve is used, the cuff on the tracheostomy tube must be deflated, or a cuffless tube can be used instead. The placement of a Passy-Muir valve in a patient who has an inflated cuff can lead to death within minutes, because while the Passy-Muir valve allows for normal inspiration, expiration is prevented by the inflated cuff in the Passy-Muir valve. The normal function of a Passy-Muir valve is to allow normal inspiration through the tracheostomy tube, but upon exhalation, the air is redirected up through the vocal cords to allow speech, cough, and to aid in swallowing. Let me show you how. Please observe me drink this glass of water. Notice that I had a brief exhalation at the end of my swallow. This occurs because as the airway opens back up at the end of a swallow, a column of air under positive pressure exits the trachea, and this helps prevent aspiration. Notice that if you don't have a Passy-Muir valve, you cannot create a column of air under positive pressure to help clear the airway at the end of a swallow. Here is an example of a trachea prior to the insertion of a trach tube. This is where the trach tube goes, and a surgical hole is created for the insertion of the tube. The hole is above the breastbone and is in the top portion of the trachea distal to the vocal cords. This is the end view of the trach as it is leading into the lungs. The top hole is theoretically the mouth or the back of the oral cavity. Here is the trach tube. You would insert it into the hole. Here's how you inflate the trach tube. You have the pilot balloon on the end that corresponds with the inflation of the balloon on the inside of the trach. You insert it in this manner and push air into the balloon. You can see as I inflate the cuff, a relatively airtight seal is created so that the air can be pushed into the lungs by the ventilator. The ventilator would be connected into here. It would push air down into the lungs. Okay? You can see that once the cuff is deflated, as it corresponds also on the pilot balloon, there is room around the outside of the trachea for air to exit to the lungs and flow through the vocal folds to create voice. A cuffless trach is often used as well in the patient who is improving and may no longer need a ventilator. As previously stated, the Passy-Muir valve can only be placed on the trach when the cuff is deflated. So here is our Passy-Muir valve. One-way valve allows for inhalation but not expiration. We would place that on our trach tube, and so this would allow the patient to inhale, and when it when the breath is let out, when the patient exhales, air is forced down into the lungs or up through the vocal folds, which would create voice, which is why the Passy-Muir valve is also called the speaking valve or the talking valve, because it allows for air to be pushed through the vocal folds and allows for speech. Even if the cuff is deflated when there is no Passy-Muir valve on the trach tube, airflow follows the path of least resistance. The path of least resistance is the shortest path between the outside world and the inside of the lung. The path of least resistance is through the tracheostomy tube as opposed to traveling further up the airway and out of the oral cavity, where there are vocal cords that come together and add resistance to the airflow. So the tracheostomy truly is the shortest pathway to the outside world and really creates an easier pathway for people to breathe because it's shorter. The Passy-Muir valve can be used to assess the readiness of a larynx that is recovering from paralysis, edema, cancer, excessive secretions, scarring, or surgery. Thanks for tuning in to this demo of how the Passy-Muir valve or the talking valve works. I hope it was helpful and I hope you enjoyed it.